the safety features of inhaled insulin are really now quite clear. Um, there is a per label instruction to check FEV1 before and then after starting inhaled insulin. And what we saw in the pediatric study was that there was actually less of a decline in FEV1 in the inhaled insulin patients than there was in the injected insulin patients, which just adds to the data set to indicate that it really is safe. The technosphere particle itself, it gets entirely excreted through the urine and doesn't appear to have any long-term known detriments to lung function. So I think as people get more and more comfortable with the safety, absolutely they can use it off label. I think the biggest challenge in the pediatric space for that is just getting payers to cover it. And so I think that will be a huge step forward when it does get a label, because it will make it harder for payers to deny coverage for it. But there are currently still some ways to get it at a relatively affordable price for families who are able to pay out of pocket for some things. And I found it to be incredibly effective tool for particular patients. Families who are really active and highly involved in sports, who have lots of problems with sports-related hypoglycemia, really do a lot better with inhaled insulin around the times of sporting events, because they can be confident that it is completely cleared within an hour of dosing, and they're not going to end up, hypoglycemic out on the football or soccer field, or while they're doing a swimming race. So that has been nice. The ability to really cover certain foods that are challenging to cover, no matter what we do with injected insulin, is another sort of use case for it that I think has been really nice to see. But it does require a different thought pattern. The way inhaled insulin is packaged, it only comes in 3 different unit strength cartridges. And so people have to get used to this idea of being sort of more round numberish with their insulin dosing. They also have to appreciate that inhaled insulin units are not equivalent to injected insulin units, and that is a challenge. So it really is. It requires about 3 inhaled insulin units to be equivalent to every injected insulin unit. And so at first, if people are sometimes a little hesitant to give that larger, 3 times larger in their mind dose, that really is the same equivalent amount of insulin. So it takes some getting used to. And then just the notion that you're going to have to take an inhalation, with the meal, and then maybe an hour later, throughout the day, takes some getting used to. But once people buy into that notion, the ease of not having to inject, to take this in public without a needle around, just provides a lot of different opportunities for people to use it. I think the areas where I'm most excited about seeing it expand its use down the road are offering it to newly diagnosed patients. We haven't yet had that opportunity where I can walk into a room and tell a newly diagnosed family of an 8-year-old, yeah, this is a terrible diagnosis, but now I can put a CGM on you so you don't have to poke your finger, 8 times a day. And I can give you 1 injection of a long-acting insulin, and all your other insulin you can take, inhaled. I personally think that's going to really play well with a lot of families as they adjust to life with diabetes. And they may not stay on it, indefinitely, but it just may make that transition easier for a lot of folks. And I know there's a plan to do studies in that space coming up. I'm also really excited about using it in combination with insulin pump, given insulin. Right now, the biggest challenge is those pumps aren't designed, at least the commercially available systems, to take in the information that somebody has given insulin from some other way. So their algorithms don't know that insulin's been given, but that can be achieved, and the company is working on Bluetooth enabled inhalation devices to track doses and push that data into these systems. And for my patients who are effectively doing that already, again, that's off label, but they get far better meal coverage from the combination of the inhaled insulin with the background support from their semi-automated insulin pump. And I could definitely see a space for inhaled insulin in the future where you might use it almost entirely as a meal announcement for these algorithms, semi-automated algorithms, to give the insulin a bit of a head start and then let the pump essentially do the rest of the work. But if you could eliminate the mental burden of having to count carbs and calculate it for every single meal, that would make life with diabetes a lot easier for lots of patients.